Welcome to today's webinar, School-Based Telehealth, a Rural Health Clinic Success Story. Today, we're going to talk about how Cape Family Medical in Southeast Missouri is using telehealth to expand access to care for K-12 students, families, schools, and rural communities. I'm Brittany Canales with the Pulse Telehealth Resource Center, PulseTRC. We provide free telehealth resources and up to 10 hours of technical assistance for organizations across Oklahoma, Kansas, and Missouri. Today, I'm joined by JD Webster. JD is the president and CEO of Cape Family Medical Clinic, and a rural health clinic in the heart of Cape Girardeau, Missouri. He has been in the healthcare sector for about 15 years in various aspects, but Cape Family is his first time running a rural health clinic. Since August of 2021, when he bought the clinic, he has been able to pioneer new ways to reach patients where they are, and with the use of telehealth for the clinic patients, rural schools, and even rural communities. Before we get into the school-based telehealth model, I want to start with a little background on Cape Family Medical Clinic. JD, can you tell us more about Cape Family Medical and how it has grown since you started in August of 2021?
I sure can. Thank you for the introduction. Cape Family Medical Clinic has been serving Cape Girardeau patients as a rural health clinic since 2001. Before that, it was a chiropractic office and a few other things. But since we got our designation as a rural health clinic in 2001, the primary focus has been on Medicaid and Medicare patients for the Cape Girardeau area and everywhere around us. In the way of what I've done since 2021, I bought the clinic in the middle of COVID. So, patients weren't coming to the rooms all the time. They didn't want to be seen in the office. So we were trying to come up with new and innovative ways to bring our healthcare to them. At that time, rural health clinics were not allowed to use telehealth. It wasn't an option for us. During COVID, they then opened up that access for us. So they allowed us to start treating patients through telehealth. And so we started using that as a device to bring healthcare to our patients who were scared to come into the waiting room. They were scared to even drive to the office or be out in the community at all. And so we were able to utilize telehealth to help us expand and reach more patients. So since 2021, like I know you said it in the beginning, we had one nurse practitioner and we had 3 patient rooms, and we had a big empty building besides that. Now we have over 20 patient rooms, a medical director, 3 medical providers, 5 mental health providers, a chiropractor, a dietitian, and even an esthetician. And all of our services are Medicaid and Medicare based, so everybody has access to it. We accept every Missouri-based insurance that's available. We take it to not leave anybody out. We offer an amazing sliding scale program for people who don't have health insurance, but also need to be seen. We've got a sliding scale that's income based, so we can make sure that we can meet them where they are. And, we never turn anybody away. So even if they can't afford it and they don't have any income, we're still going to treat them. We're going to make sure that the patient is taken care of. So we've been able to show some exceptional growth, but I can say the primary focus behind that has been telehealth. That's been probably the biggest thing that we've been able to do. So one of the biggest challenges that we faced was people not having access to either be able to get here or good Wi-Fi signal. So initially, when we started, we put on a big antenna on top of our building that shoots Wi-Fi around us. So it spreads it in about a 4-block radius in a circle. So this gave people who are close to us able to use the Wi-Fi, but also it allowed people to drive into our parking lot or around us, and they could use their phone to access telehealth. So then our providers could treat them from inside the office. And that worked out really well. It alleviated a lot of the fears that we were dealing with people wanting to come into the building. But then what we quickly realized is that patients really liked the use of the telehealth. They liked not having to come all the way down here, either taking public transit or taking some kind of borrowing rides from other people. So transportation was one of the biggest things that we dealt with in the way of our community. We don't have a very good public transit program here in Cape Girardeau, and then in the rural areas we serve, there is no public transportation. So for somebody to get from a smaller town, even 10 miles away from us to here, they were having to find rides. They were having to ask people or find friends to get them here, and that became a big barrier for us. So telehealth helped us to reach them right where they're at, either using their own phone and using their data, or going to any other local place. And so one of the things that we did on our website, we started posting where free Wi-Fi spots were in other communities. So that way, if they were in Chaffee or Delta or any other town, they could go to our website and say, okay, McDonald's or whoever it is has, they've got free Wi-Fi that they can use. So that way, again, they don't have to drive all the way up here. They can get closer to their own town and have it. And then we started looking at new ways to provide telehealth because so many people were utilizing it. So one of the next things we did was we started talking to a lot of the rural schools. So rural schools are dealing with no actual nurses in their healthcare realm anymore. The school nurse, the quote unquote nurse, a lot of times in these rural communities is just the office administrator. So they have no real medical background. And so when a student comes to them and says, hey, I'm sick, they've got no way to diagnose them. So they just send them home. And now the parent has to take off work, which means that they're losing income. And most of America, we live paycheck to paycheck. So this hurts not just the student, it also hurts the school, because the school, they get paid when students are in class. They don't get paid when students aren't in class. And then the parent now has to take time off work, not just once, but 2 to 3 times. So they got to take off work to come get their student, take them home. Then they've got to take off work to take them to a medical appointment, which again is losing them more income. And then they got to bring them back to school, and that gets taken care of. So what we were able to do is we have a telehealth kit that we provide to schools. It's got everything that we do in our office. So it's got an EKG, a blood pressure cuff, stethoscope, you name it. Everything that we've got in our office, minus an x-ray machine, is in this kit. We drop it off at the schools. We send them, we go up there and do a couple hours worth of training with all of the school nurses and admins and everybody else who wants to see it. And then essentially what they've got is a doc in a box. So now when a student is not feeling well, or they're, whatever it may be, they're sick, they go to the school nurse or whoever it is and say, hey, I'm not feeling well. The nurse then gets in touch with us. And at the same time, they get in touch with the student's parent or guardian. And then all of us, our medical team, the parent and the student, all get on our video telehealth kit at the same time. We're able to diagnose the student before the parent even leaves work, because not all the time does the parent actually have to leave work. So we're able to diagnose the student, order medications if needed. A lot of the pharmacies that we work with will even drop off medications to the school, so that way the student has it. So again, they don't have to leave. But if the student does have to leave, we're able to have that prescription sent before the parent generally even gets to the school. So now, instead of the parent missing a big chunk of work, hours doing this and that, they're missing minutes at this point. So they're now driving from their job to the school, picking the student up, taking them to the pharmacy to pick up their medication, and then taking them home. All can be done in a whole lot shorter time. But now the student is going to get well faster, which is going to put them back in school, which means they're going to miss less school, and the parent's going to miss less work. And then the school can actually get reimbursed because the student will be there. So it's really kind of a win-win-win across the board with school-based telehealth. And then what we found, which was kind of not planned, but ended up being really good for us and for the schools, is the students, or the faculty and the teachers and everybody else, started asking, well, if we're not feeling well, can we use the telehealth kit? Can we get in touch with you guys? And, again, it wasn't planned. The plan was only for students, but it ended up, it doesn't affect us who we see. Our goal is to treat people where they're at. And so now we started seeing faculty and teachers and everything else. And then they'll even have it on special game days and everything else. They'll take our kit to sporting events to make sure that if a student gets anything happen, they've got our kit. They don't need us for everything, but they've got our kits there. So if something happens, the student can be taken care of even at sporting events. So it's turned out to be a really a bigger program than we thought it to be, but it's been a great win for us. And we've had huge success throughout northern rural Missouri and now southern rural Missouri, which is awesome. And then, we try to simplify the process. Our Pulse team has done a really good job of simplifying the process even more, and creating a how-to book on, how to run the kit. And it's made it very easy with color-coded guides and everything else to make sure that, in case somebody is in the building who didn't go through the training with myself or one of our team, they can open up the book, and it's so simple that they can follow the steps and get right in touch with us the right way. So, the steps are honestly pretty easy. A student's going to come in and say, I'm sick, or a teacher or faculty, somebody's going to come in and say, I'm sick, I need to see the medical provider. They're going to open up the kit, turn on the monitor, put in the username and password that we assign for each school, so that way the system stays locked. At the same time, the school nurse is going to get in touch. They've got a special phone number that they call that's only for school-based telehealth. So they're going to reach out. They're going to get somebody on our staff who's going to answer that phone specifically, get all the pertinent information just like they would if the person was here in the building. So we're going to have them, we've got a Bluetooth scale and everything there. So we're going to get their weights, their blood pressure, all the things that we need, talk to them about, what do they need to be seen for, what's going on, all that. And then once we have the initial triage taken care of, we then pass it on to our medical provider. Our medical provider is going to log right into the same system, get to see the patient, get to see the parent at the same time. If the parent is going to be on the call, we can take care of both their needs right then and there. The provider can then, from our tablet, utilize everything inside that kit. So if they say, we need you to use the stethoscope, they push a little simple button on the kit. The student can then hold the stethoscope right up to their chest, and then the parent or the provider can say, move it a little bit left, move a little bit right, breathe in deep, do all the things just like you were in the office, only now it's driven fully from a telehealth network, which is just the most amazing thing. Our EKG system is spectacular. So in case somebody's having some kind of an arrhythmia or something else, again, it's so simple, this system, that a student by themselves, without anybody being in the room, can work our EKG. It hooks up to a special device that's inside the kit. It's got 3 little nodes. One goes under each armpit, and then one goes in the belt line. And then it runs, and it is just as high quality as any other EKG on the market today. And it gets us a spectacular report super quick. Within a couple seconds, our provider is now able to see the entire EKG report, which is going to tell us, how serious the situation is, and do we need to take it any further. So these kits have made our telehealth network, something I think that's comparison to nothing around us. I mean, it's really changed the game on what we can do and who we can help. The next step that we started doing with that is mental health. So a lot of the students and the nurses and the teachers and everybody else started talking to us. Well, we know you have mental health providers. Could we utilize mental health? Because a lot of the students, again, this is coming out of COVID. So there were a lot of students dealing with some different mental health traumas and other things that they weren't sure how to deal with. So they reached out to us, and so it was a simple yes for us. We've got mental health providers. We do telehealth through mental health as well. So now we've even got a scheduled mental health visits with the school. So a lot of the schools that we're working with, the students will use their, I call it the free time or the seminar period. I'm old, so when I was in school, it was called something different. Every school has a different name for it, but their study hall, essentially, at the end of the day. So the students can use their study hall and have it scheduled, so we already know who's going to be there and when, and then they can go to a private room wherever these kits are kept, and then they can have a one-to-one video conversation with our mental health provider, who can work with them on a one-to-one basis. They're comfortable because they're in a safe space that they know and feel good with. They don't have to drive and have the stigma of visiting a mental health clinic or anything else. They feel very safe where they're at, and that has proven to be about almost half of our telehealth visits with schools now has ended up being mental health, which is pretty exciting for us, because again, it was something we didn't plan on. It wasn't something that we went into it saying, let's do this. It just came out naturally, and it worked out really well. And then one of the, probably in my opinion, one of the coolest things that have come out of school-based telehealth is our goal was never to replace their primary care provider. We still want people to visit their primary care provider, go see them in their office. That was never our goal. But what we found out is many of the students, the parents, the teachers don't have a primary care provider. Some of the schools that we go to, the next closest primary care office is like 41 minutes away. And that's a really long drive, when you're going to drive 41 minutes, and then you're going to wait in the waiting room 30 plus minutes, and then you're going to see the provider 30 minutes, and then you're going to drive out. So, it's half a day gone to go to a primary care office. So what we have done now is kind of taking over the primary care for a lot of these students, parents, faculty, and everybody else. And so we're doing, medication refills. We can diagnose just about everything. We can't run labs through telehealth, but I mean, besides the labs, we can diagnose a lot of things. Or if we believe somebody needs labs, we can write the order and say, go to the lab of your choice, go to the nearest lab, and we can even tell them who their nearest lab is because it's part of our interface. And so they can go to a lab right in their office or right in their town. It gets sent back to us, and again, we can take care of most of what they've done. Since we started doing telehealth, on telehealth alone, we have 77 new diabetics last year that we were able to discover in school-based telehealth. So 77 people who did not even know they were diabetic came to us, started, for whatever reason that they brought them to us. But from that, we've been able to diagnose, get labs drawn, and figure out all these other things. And, we've been able to figure out that they're diabetic and they need to be on a medication, and that's going to help them solve some of the other issues that they're dealing with. And diabetes is a very serious thing. So a lot of people don't even realize that they're pre-diabetic or that they are diabetic because it comes on for most people pretty slowly. So they start getting dizzy spells, or they get dizzy when they bend over. They don't even know what's going on. So that was another big thing for us. That's one of the biggest things I say for me that made it really good for me was that, we're able to diagnose these things without them realizing it. So that was kind of the neat thing. So naturally, after school-based telehealth started working so well, we had patients who come to our office. They'll still park in the parking lot. So we're still treating our internal patients with telehealth, if it works better for them. We're doing telehealth for our mental health, which is just going great. And then our school-based telehealth, which is, grown exponentially in the way of the services that we offer and other things. So then we started thinking, how else can we utilize telehealth to reach more people, to be more proactive, to help people in ways that we haven't done before. So we started a hybrid mobile clinic, essentially, is what we're doing. So we take one of our triage nurses, and she brings the telehealth kit with her, and we've got some really cool nonprofits, community outreach groups, even some local churches that we work with in these smaller towns all around us. And so we announce to the community, and the local group also announces to the community and says, hey, Cape Family Medical Clinic is going to be here the first Monday of every month. They're going to be here at 9 in the morning until 4 p.m. and they're able to see and treat patients. And so what we do is my triage person goes down there. They do all the patient intake. So if they're a new patient for us, they help them fill out the paperwork. We bring tablets and everything to help the patients be able to fill out the paperwork, get their insurance information, do all the basic stuff. And then when it's time to be seen, my triage person will then take their weights, take their blood pressure, go through all the triage measures that we would do in the office. If there's a lab that needs to be done, our medical provider that's on the other side can tell our triage person, hey, we really need this lab done, or we need this, urine drug screen, or anything that can be done. Strep tests, COVID, flu, A and B, pregnancy tests, all those things we bring with us down there to each and every one of these mobile clinics. And it allows us to be able to treat patients, again, where they are. So now they don't have to worry about driving to Cape Girardeau. They just got to drive to the local community place. They got to drive to the local church or the local nonprofit group, wherever it may be, which has made it dramatically easier for them to be able to be seen and get the help that they need. And from that, we're now going to start offering mental health telehealth for these patients. So patients that come to us and they're being treated for whatever it may be. If they've had anxiety, depression, or anything else that they're dealing with, they just need somebody to talk to. While they're there with our medical provider on the other end of the computer, they can say, hey, if you'd like to be set up with one of our mental health providers, we can give them a list of names. We've got them age ranges from newly fresh out of school to been doing it 40 some years. men and women both. We've got everybody to make somebody feel comfortable. And then we're able to now start treating them for mental health. And so a lot of times with that, we don't bring the whole kit down there for that, but we will set them up on their phone. We give them a little link to our telehealth profile or profile, so that way they can link directly from their house. They can sit where they're extremely comfortable and have a conversation with our mental health provider through video conferencing, so that way they can get the help they need, again, where they're at. And without telehealth, it definitely wouldn't have been something that we could offer. So this has been able to help us spread out and expand, not just who we can help, but what we can help and how many other people that we can do. So it's been a really good thing for us to be able to have telehealth. I can tell you one of the hardest things that we deal with is because rural health was not allowed telehealth up until the start of COVID. Every year, every November, we get a message from the government saying you're no longer allowed to do telehealth until House bill passes. And then so there'll be 4 weeks to 8 weeks, and with anything else going on in the political structure of the world right now, who knows? But we can go many weeks where we're still doing telehealth. We're just technically not allowed to bill for it. So we're just doing it as a free service, but we don't want to leave people without help, so we continue to do it. But this happens every year for us since 2021. Every year it's happened where they said, okay, you can't do telehealth. So that is one of the biggest things that we fight is wondering, is it going to be extended? Is it going to be allowed for the long term? Is it going to, are we going to get stopped again? And all of the schools and the community groups that we deal with, we are upfront as honest as possible with them. So we always let them know in advance and say, hey, just so you know, this November, we're probably not going to be allowed to do it, but we're going to continue to do it. But then, that does drive a little bit of fear into a lot of our patients and a lot of the groups that we deal with, because they want to continue the help that they're getting. So that is probably the biggest thing that we have to deal with in the way of fear amongst everybody. The second thing that we deal with is probably the thing I find a little bananas, in my opinion. A lot of the schools that we work with, they're nervous of partnering with a single medical clinic because they don't want to show favoritism towards any one clinic, especially if they've got, we've got two very large hospitals in our backyard right here in the same town with us. So the local schools, they get donations from these two large hospitals. And so they don't want to partner, or they're scared of partnering with a clinic because they don't want to alienate the two hospitals that do so much stuff with them. And that happens in a lot of these communities. These rural schools may have something where a rural hospital or a local hospital, when I say local, within 60 miles of them, will offer them some kind of service at a discounted rate, and they're nervous of partnering with us simply because they don't want to alienate the hospital by partnering with us, by saying, well, now we've picked Cape Family Medical Clinic. So to get around that, part of what we do is we don't even brand any of our stuff with the schools. We have zero branding on anything. So the only person or the people that know that we're Cape Family Medical is obviously the administrators and that, and then the students or the parents only when they decide to utilize our service. Then we tell them, hey, by the way, we're Cape Family Medical, we're located here. So that way, in case there's follow-up, they know who to get a hold of. But we have gone with a completely unbranded system, so we don't need recognition for what we're doing. Again, we're just trying to take care of people where they're at. But that has probably been the oddest fight I can say that I deal with, is when I'm talking to school administrators and their pushback is, well, we're nervous of partnering with you because we have all these other hospitals that are around us. So we have went with an unbranded partnership program, so that way it's been able to alleviate a lot of the fear and the concerns that the administrators have been dealing with. In the way of how telehealth is going to look for us, I say in the future, how it's going to help us present more is, my goal is to get in front of more schools. I want to be in front of every school. I want our service in every rural school that is within 120 miles of us. If it's a rural school and they're needing help, that is what I want to do. And speaking as a clinic owner, right? You say to yourself, well, it sounds great to do these things, but no money, no mission, right? So if you can't charge for it, you can't bill for it, you can't do these other things, then how am I supposed to keep the doors open and the lights on? How am I supposed to keep paying these providers? And I'll tell you, it started off very slow in the way of schools. Our first year, and I know that on this presentation, we've gone over the graph to show how much we've been able to grow in telehealth. The first year, our telehealth was very, very slow. The second year, I would say, even comparatively, comparing us to other clinics, it was still very, very slow. But after we started having some really cool wins, some of the schools started utilizing us a lot more. Students have graduated and then become patients of ours. Our telehealth has grown just dramatically year over year. And from 25 to 26, like already, we're competing already. We're in May and we're very close to the number of 2025. So our telehealth keeps rising. It's a huge bucket for us now. And because of that, we've got one provider that we're hiring another provider right now, and the goal for this provider is to do nothing but telehealth. So that's going to be this whole provider's job, is to sit here in the office at the computer screen and just treat people through telehealth. And so as an owner, you say, well, how can I afford it? And now I can honestly say, years later, I can't afford not to do it. You go into the process properly, you build the system the right way. The team at the TRC can help to build the system the right way, help you to build your own system, to lead, guide, and coach you into the correct steps. You find your own. They can help you find the software or the hardware that works for you. But once you have that in place and you've got the framework in place, you've got the foundation built, then it's just putting boards on top of boards, and pretty soon you've got a very big house you've already built, because it's built on a solid foundation. So for us, our telehealth has been able to not just sustain itself, it has actually become a big part of our success story. It's the reason that we're able to do all the things we're able to do here. So telehealth is only going to expand for us. We're going to only offer more services. We just this year added a telehealth dietitian, which has just been great. So we're now offering medical nutrition therapy through telehealth. So our dietitian doesn't live in the same town as us, but she's licensed in Missouri. So it's worked out really well, and she's able to help people get healthier, to stay in different mindset of health and nutrition, combining it with what our team does already for medical and chiropractic and everything else. And now we've added the nutrition support. So this is a new aspect for us. Again, as all new things, it started off kind of slow, but it's picking up some good speed as we're going. And the hope is by the end of this year, we have to bring on another dietitian, so that way we can help to service the rest of our patients. In the future, I don't know, as many services as I can possibly offer is the best thing I can say. Is I'm bringing on a medical provider who's going to do nothing but telehealth. We've got 2 mental health providers who do nothing but telehealth. I've got a dietitian who does nothing but telehealth. And then my goal is to bring on more schools, to add more rural access points and more rural hubs, so that way we can get people right where they're at, and keep utilizing telehealth as what it was meant for, to bring health to people who don't have a way to get to their health, to provide health and nutrition and mental health and medical health and all of the things to the people where they're at, where they're comfortable, to make it easier for them to achieve the same things that people who live in, larger towns. We're very lucky in Cape Girardeau. We're kind of like the central hub between Memphis, Tennessee, and St. Louis, Missouri. So we've got a lot of support here in this community. Our public transportation isn't the best, but we do have public transportation. We've got Uber and Lyft and all the other things here. You go 6 miles south, you don't have that anymore. The smaller towns, Scott City, Kelso, Delta, all of them that are around us, they don't have any type of public transportation. There's no Uber that's going to go out to them because it's such a long drive one way that they just don't have it. There's not good Wi-Fi signals out there. There's no medical support out there. There's no mental health support out there. There's none of the things that make living inside of a small town or a small city what Cape Girardeau is a small city, but living inside the small city is really good because we have access to all those things. But we're fortunate enough to know that going 6 miles any which direction, you lose all of those things. You don't have the same access. You don't have the same ability. So that is where we're taking telehealth to the next level. We are going to start pushing telehealth out into more communities. We're starting to reach out to more nonprofit groups, to more community hubs, to more, even churches. That I said, anybody that is wanting to help their community grow, help their community get healthier, that's who we're looking for, and that's who we're partnering with. And I think it's working really well for us, actually. Some of that COVID grant money that was out there, it got reallocated into mental health, which was interesting. So a lot of these rural schools around us got this, some of them got like the weirdest 18-month grant, which really don't work well for a school because there's no school that's 18 months. But some got these 18-month and 2-year grants where they were able to hire a mental health provider and then offer it free of charge to the students during that grant period. But what the schools didn't think about, didn't plan on, didn't realize was that the grant was very short term and it was only COVID reallocation. So now, at this point, almost every one of them that I know of, mental health providers in the schools, have been terminated because there's no money to pay for it, right? They gotta bill for it and they can't. So now they're looking for alternative ways to offer mental health to their students. So that's how it's been coming to us, is the parents, when we talk to them, do you guys offer mental health? Of course we do. The nurses, the school nurses and the administrators asked, do we provide mental health? What does it look like? What age groups and everything else? And so we just give them a real basic guideline of what it looks like. And then it's up to them. The parent and the student has to schedule it. The parent technically doesn't have to be in the room, but we require them to be in the room unless they're going to talk about the parent. If a student needs to have private conversations without the parent, we will ask the parent to leave during those sections. Mm-hmm. But for the most part, the parent and the student are in the class, or even the mental health appointments together, because we don't want to leave the parent out or make them feel any way about it. They want to keep doing it because they pay a lower rate. They love telehealth because they pay a lower rate, but the cost for me is much less for telehealth, so it doesn't affect, honestly, as a clinic owner, it doesn't affect any of us, because you don't have somebody in a chair that you're taking up space. You don't have a room that we've got to go disinfect the second they leave. You don't have the receptionist and all the other hours that are tied up into a patient visit. A lot of things are tied up into a in-person patient visit that you don't have as a telehealth. So for us, our costs dramatically decrease on a telehealth appointment also. So if I had a full telehealth clinic, I would need one receptionist and then just as many medical and mental health providers as I possibly could. I wouldn't need a building or any of this other hoo-ha. The $5,000 a month building payment and the $1,700 a month electric payment and all those other things. I wouldn't need any of that because it'd all be telehealth. They could all sit at their house and hang out and do it. It'd be awesome. So a couple, both and all. So when it comes to technical support, if it's a minor thing, they'll get a hold of our office manager first. She goes through the basic things that we've seen a lot of schools deal with, or that we deal with, in-house. So when it comes to technical support, if it's something that we know how to deal with, they'll get a hold of our office manager first. She'll go through, little troubleshooting tips and tricks. Have you done this? Have you done that? And at the end of the day, it's a giant computer. So it always starts with, have you restarted it? And then that honestly fixes the majority of the issues, which I find to be funny because it drives me crazy that it actually works. But that does fix a lot of the things. If that doesn't fix it, then we do have a dedicated person at our telehealth support company. So they'll get in touch with the school or us directly and say, okay, you've done XYZ. Now let's go into a deep dive. They'll connect directly to the system and able to troubleshoot a whole list of other things, which is pretty awesome. And then, like, we've got one school that we're dealing with, the stethoscope don't work. And so the troubleshooting was, they had to literally unplug the stethoscope directly from the kit, plug it into a wall outlet to see if it was going to charge properly. It didn't. So now we're sending the whole kit back and they're sending us a brand new kit. So because there's something that's interfering with one of the mechanisms inside the kit. So our group that we buy the kits from, they said, we're going to go ahead and take it back and we're just going to replace it. And so they're replacing it for us. So that's always worked out really good. So they're literally sending the box to the school. The school's putting the old kit back in the box and then returning to sender. No, so that's all done through our portal. So when we have a new student sign up, that is what they. So when the school gets in touch with us and says new student to you is going to start filling out paperwork, we will then have the school get in touch with the parent, and we send a real quick link over to the parent either through their email or text message. Doesn't matter either way. The parent can fill out real basic information just to start the appointment: name, date of birth, gender, address, the most basic stuff that we need just to start the appointment. Once the parent starts that, then our triage person will start talking to the student with the parent on the line. We tell the parents if they're driving, don't turn on the video. They can just leave us Bluetooth audio only. That way they can chime in. But then our triage person will go through and get the rest of the information from the parent and the student. What are they feeling? What's going on? All these other things. And then have them stand on the scale and do other things. So we get the weights and the real basic stuff. And then our kits are so simple that literally we've got a fourth grader 2 weeks ago that did their own blood pressure. Never heard of a blood pressure cuff, but our triage person was able to say, it's the white thing in the front right corner of the box. Pick up the lid, you'll see it, slide it onto your arm, show me where it's at, and went through and got blood pressure successfully from a fourth grader who's never had their blood pressure drawn. So the kits are very, very simple. It was very cool how it works. But then from that point, it goes right over to the provider, and then the provider can take care of them right after that. I've only sent the new training guide to one school because I haven't introduced it to the schools that we're already at, because so far, knocking on wood, they're running it fine. They're not having an issue. The newest school that we sent it to was DeSoto, and the reason I sent it to them is because, one, they're our newest school, and so they went through training with me personally, and then I sent them the newest packet and said, hey, give this to somebody who's never seen the kit before, and let's see if they can do it. And they actually did it. The superintendent of the school actually logged on and did it, which I thought was funny because he's about as technologically as savvy as myself, which is to say we're not. And he was able to get through the program just fine on the last one. So the new booklet is much easier than the first booklet, because that first booklet was wrote by me and it was not good. It was very simple and actually overcomplicated, because I don't even know why I did it. It was bad. No, so we do not offer a specialist as part of our telehealth. So our clinic, we strategically stay separated from both of the large hospitals around us. We don't want to show affiliation with one or the other. Our patients are more comfortable with the fact that we're not pushing any one quote unquote brand over the other. And so we don't partner with any of there's Mo Delta, Mercy, and St. Francis, and we don't partner with any of them. So we don't bring on any of their specialists. But if we do have a patient who has only utilized us for telehealth, or telehealth is the best way for them, we have a medical records person. Her job is to find out what their insurance will and won't cover. And whenever possible, if the patient prefers telehealth, we will then find out who's in their network. Do they offer telehealth? And then when we schedule their specialist appointment, we'll schedule it through telehealth. So that way the patient has the same experience with just a different provider at the end of the day. So we do all the work for the patient to make sure that they have the care that they're looking for. So if there is a copay, or if they don't have insurance and they do need to pay, we bill them afterwards. So we'll send them a bill through. It comes right on their email. Or actually, if they say I prefer it on text, then we send it to them through text, whichever way is easier for them. Or if they want it in mail, we can even snail mail it and send them an actual paper invoice. Any which way that makes it easier for them. So I can say that as a clinic owner, telehealth is a huge success for me. It's been a huge success for our little clinic. We deal with two major hospitals right here, like literally one's a half mile away, one's 1.5 miles away. And when I say major, I mean they are major players in the game. They spend more money on advertising on billboards in a month than I bring in revenue. They're that kind of large. And so for us, we've had to change. I'm not going to compete with these hospitals, and I assume most other single operators aren't going to compete. But what we have been able to do, how we have been able to be successful, is going after the things that these large facilities aren't looking for. Everybody's already choosing them. Everybody's already going to them. But as a small operator, by bringing healthcare to people where they're at, how they can access it. The best way for them to consume the health that we're offering is through telehealth, and telehealth is the great leveler of all things. We are able to reach people in, I mean, right now, I'm in 12 counties and 40 some cities or towns and cities that we have successfully reached patients. And I don't have to open up a clinic in each one of these towns like these large players can do. I don't have to buy the $1 million bus and drive it around to these communities and, pay for all the things that come with it that these large facilities can do. I can send one of my employees and pay them a good fair wage and pay their mile and do all the things with a telehealth kit, and I'm able to bring the same level of care, in my opinion, better level of care to these small communities. That I think that's how we compete with these large ones. So if there is any clinic out there that is looking for a way to expand your footprint, offer more services to more people, help drive your bottom line. Telehealth has an upfront cost. You don't have to go the same way with me. You don't have to go buy the telehealth kits and spend the money on that. You can literally do the same thing with me as I do, only do it smaller. You can buy on Amazon. You can buy an automatic blood pressure cuff and a scale and some very simple things, and start with schools with that. You don't have to have all the same things that we offer. You can put these same things that the scale, the blood pressure cuff, and these other things, you can simply put them in a toolbox and send an employee into a community outreach location. You don't have to buy the kit. You've just got to have a telehealth, a HIPAA compliant telehealth platform that you can use, and the TRC can help find that one that is for you. They can find the one that is proper for you and your service, and then just start. I mean, you can start so inexpensively, a couple $100, and you can start a telehealth journey. For your patients, if you just post up, hey, if you just need med refills and you want a very simple appointment, let's utilize telehealth. Free up time and space in your clinic. Don't spend all the money on cleaning the rooms and paying the receptionist and doing all those things. Offer telehealth, and it will increase the number of patients that you can see in a day. So all of these little things that can be done, I say it's low-hanging fruit, but as an operator, it has become very large fruit for me. Telehealth has become, it's probably right now about a third of our total output, and that's pretty good because we're seeing 17,000 patients this year. This year, 2026, we're on pace to do 17,000 patient visits, and telehealth is going to be about a third of that for us, so at least 25%. So we're on pace. Telehealth is going to become its own business inside of our clinic. So for me, telehealth is the biggest success I can say that we've had. It's probably the number one feather in my cap because it's been able to expand us without stretching our budget, without stretching our finances farther than what it needs to be. And it is bringing money to the bottom line, which is helpful because of that, we're now able to expand what we can do at our clinic because we've got this other platform to help us grow our business. So telehealth is the reason that we're still here. It's the reason we're still expanding. It's the reason that we're going to continue to expand and grow. So if you are looking for a way, your clinic is struggling, I'm sure the everybody around you would like to see, you grow, because most community clinics, the community wants you to grow. This is how you can do it. So for sure, telehealth is the right way to do it.
If you have any questions after today's webinar or want to connect with us, you can visit us at pulsetrc.org, or you can reach out to us directly. Thank you again for everyone who joined us today.